So I've removed most of the local anaesthetic from Kerry's face, but I'm just now going to wash it and make sure that there's no local anaesthetic left on the skin. It's important to dry the skin because both wavelengths of the device are actually looking for water. So if I leave the surface wet, then the energy is going to be there on the surface. Now, taking a white pencil, I'm going to actually mark out the areas because it's important that we actually apply the device in straight lines. And so I don't want to be tempted to go around the curves of the face. So white pencil is better because using a white pencil means I'm not going to impregnate the skin with any colour. So if I use a black, then I might leave some of that residue behind. I'm marking out the areas that I actually want to home in on. So the forehead is going to be treated slightly differently to the eye because the eye is more sensitive. And then I'm going to actually make oblongs or squares because the machine is flat, the face is curved, so I've got to try to keep things in a very straight line. Okay, so now we've marked Kerry up, it's time to put our goggles on. So these are mine, and these are the patient goggles. Now it's time for me to press the blue button. So now it's asking me to select the treatment level. Selecting the treatment level can be done by pressing this button here. So at the moment you'll see 1 blue light, 2 blue lights, 3 blue lights. This will reflect the intensity of the treatment. So when 3 blue lights are showing, it's high, 1 is low, and 2 is medium. So when I've selected my treatment level, then I press the star button, okay? And then the timing will begin. So the handpiece is square and the face or the body is curved. So I need to actually get the patient to be as flat and conforming as possible. So I'm going to ask Kerry to turn her head to the side. And then when I'm actually using the tip, I want to have the handpiece and the rollers in contact with the skin all the time. So it's perpendicular and I'm going to work backwards. And my first pass would be here. I'm going to start now. So the start button has been pressed and my guide light is on the skin. And I'm going to roll it towards me. I'm going to make 2 passes over the same spot. Now the tip will actually change colour, and if it goes red, then I'm going too fast. The whole idea is to lay a certain amount of lesions down on the skin, and if that indication is there, then I'm not doing that. So that's the noise, that's a normal noise, and as I pass down, I'm going over it 100%. So basically I'm doing 2 passes in one direction. And I have to get my passes right next to each other. I don't want any gaps and I don't want any overlap. How's this feeling, Kerry?
Fine.
And so the protocol for Clear and Brilliant is 4 passes. 2 vertical, 2 horizontal. But we're going to treat some pores today, and so we will do an additional 4 passes over those areas. So that's about the speed at which one should go. So I've done 2 passes and I'm going to come the other way now. I'm going to start here and I'm going to roll this way. You'll notice as I roll, I'm moving my hand round the corner because I have to make sure that the tip is in contact with the skin. And I'm lifting the tip off the skin. If I was to just go back and forth, then at each end I'm going to get more treatment, hot spots, and I could create a trauma to the skin. So that's the 4 passes on the forehead. And when we come to do the areas where she has pores, I will go over this area again for her. Also, what the Clear and Brilliant can do on a temporary basis is plump out the lips. And so Kerry would like me to do that. Before the local anaesthetic wears off, I'm going to do around her lips first of all, so that you can actually see what kind of plumping effect you get. And it is temporary, but it's a nice party treatment, but also it allows the patients to see what their lips could look like if they actually maybe had a lip filler or something of that nature. So I'm going to come across and then down onto the lip, and I'll do half of the lip, so you just get that instant plumping. So you okay for me to do that? So we're going to come here. 2 passes to the bottom lip, 2 passes, and then I'm going to come down from the underneath the nose onto the actual lip itself. We did put some local anaesthetic here. So you can start to see already how it is plumping out. There's an increase in volume on one side rather than the other. So I'll do the other side for her. Okay, so we'll turn Kerry's head again to the side, and this time we'll actually do this section here. So I'm just going to move her goggles slightly, still protecting her. I'm going to come down here and start the same process. Always at a steady speed. Okay, so we're going to go the other way now. If the patient had flaccid skin, then I would stretch it a little bit more to give some support, but Kerry is young, so she's got firm skin. So I'll also treat the earlobe because this is exposed to the sun all the time, and as we get older the earlobe becomes flatter and also elongated. So by putting a little bit of extra collagen in there, it's always helpful. Okay, so I'm going to ask Kerry to come back to the centre, and you can see how the lips have plumped up, and I'm going to do this section now. Here we go, Kerry. It's important to try to get into all the nooks and crannies around the nose, and so you can cover all the skin surface. And then to do a little bit around the eye, I'm going to pull down the skin and hold my finger near to the lower part of the eye, pulling the skin down, and then with the other finger I'm just keeping the goggles in situ. so we can get to near to the eye as possible, but without putting the patient at risk. Now, if the patient had a tattoo, facial tattoo, eyebrow, around the lips, sometimes they have beauty spots put on, then I wouldn't actually be going over the tattoo with the actual device. Now we're going to just do the nose area. So we're going to come down, again, 100% overlap. And then just down the tip. Okay. So that's 4 passes on that side, and I'm going to repeat it on the other side. Again, I'm going to go in straight lines, 4 passes to one way, to the other. And I've already done the lips on this side, so I won't be repeating that. And then once I've done that, then we'll actually concentrate on the additional 4 areas that we're going to do, 4 passes in this area, across the nose, a little bit up on the forehead, and there's a little bit of congestion that actually happens on the chin. So I'm going to ask Kerry to change onto this side, and we'll start again. Okay, so I'm pressing the star button, and that will actually pause the treatment. The clock is still continuing to go, so it's always good to make sure that your patient has actually been to the bathroom before they start treatment, and so you don't waste any time. I can now safely take off her goggles.